I work in a hospital, and in this hospital what we do is to treat patients. We try to treat patients and make them improve of their diseases. The research helps us to better understand diseases, to know what it causes them, and to develop new and more effective treatments. We would like to cure all the patients who come to our hospitals, but unfortunately, we still cannot do that. So we need to invest in research to be able to help all of them. In Sant Joan de Déu, we do clinical research. We do research trying to improve the treatment of the patients we take care of. Basically, we conduct research in the areas in which we treat patients. We treat patients, we treat children, we treat mothers, we treat individuals with mental disorders, we also treat individuals with disabilities. We have also a general hospital. Our research is focused on all these type of disorders. In the last 20 years or 30 years, there have been huge improvements in the treatment, for example, of the people with cancer. 30 years ago, cancer was a disease that caused the death of the majority of people who suffer from that. Now, we are able to cure the majority of people who have cancer. That's a big change. And this big change was achieved through the investment in research. And as you may have seen, this investment in research has been able to change the natural history of cancer. Not only that, cancer was a disease with a lot of stigma. Now people are able to say that they suffered from that because they know that that's not a diagnosis of death. Great improvements have also been produced in the area of mental health. The treatments we had 20 years ago had a lot of side effects. Frequently individuals who took them had rigidity, had a lot of adverse events. Our treatments nowadays are not only effective, but only are much more tolerated. And this allows the people who have mental disorders to have a much more normal life. Our hospitals are devoted to take care of our patients. So the budget of the hospitals is dedicated to treating people. We need additional money to fund research, and we get this additional money mostly from public funds. The Spanish government, the European Commissions, they all give funding to projects who present themselves into competitive calls. We also get money from individuals, from companies, from charities. And for us, this money is very important for two reasons. First, because usually they provide a lot of help economically, but also because they show us that what we do is important for the society. First of all, we need to thank the patients who participate in our research. As you know, our research is based or tries to improve the understanding of diseases and the treatment of the patients. And this can only be done with the participation of the patients who come to our hospitals. Secondly, we need the people to understand the relevance of research. We need our politicians to invest more and more money in research. And they will do that if they see that the society is worried about how much money is invested in research. The research of Spain 30 years ago was very poor. There was very little investment in research, very few groups in the country. However, for maybe 20 years, there has been a lot of investment, public investment, in trying to create research groups, in trying to invest people so that we have better investigators, in trying to put our research at the first world level. Unfortunately, during the last maybe 5 years, the investment in research in Spain has decreased a lot. And this has caused that our research groups have much more difficulty in funding their projects. But not only that, is that many very good investigators are leaving the country or are moving to private companies. It's very difficult to create a research group of people well-educated, well-trained, people who are very good investigators. And we may lose this in a few years So it's very important that the tendency changes and that the investment in research increases a lot.